Hi there, I'm Karen Owoc. Today I want to help you understand what diabetes really is in a way that feels simple, clear, and reassuring. Many of you may be newly diagnosed, and others are managing diabetes while going through long term health challenges or treatment. So, before we begin, I want to start by telling you that diabetes is not a moral failure. Your body is asking for support, and we're here to help you understand what it needs. Today, we'll talk about what diabetes actually is, what insulin does and why it matters, and how diabetes affects your body, especially your energy. This foundation sets you up for part two. This is where we'll go into what you can do. We'll get into movement strategies, nutrition flips, and day to day tools to safely and effectively lower your blood sugar and rebuild your energy. Diabetes means glucose, your body's main fuel, is having trouble getting into your cells. So it stays in your bloodstream longer than your body can comfortably handle. You need insulin to help glucose enter your cells. When insulin is low, or when your cells stop responding, glucose builds up in your bloodstream. You end up with high blood sugar outside your cells and low energy inside your cells. This helps explain why you may feel tired or foggy even when your numbers are high. Here's how insulin works. Think of insulin as a key that unlocks your cells. When you eat, your body breaks down food into glucose, and insulin opens the door so that glucose can move inside your cells and become energy. With type 1 diabetes, the body doesn't make insulin. With type 2 diabetes, the body may make insulin, sometimes a lot, but the cells don't respond to it very well. Either way, instead of fueling your muscles, brain, and organs, glucose stays in the bloodstream. That is, it can't get past the cell door. Insulin resistance develops slowly over time. It usually builds up silently for years, even in people who seem healthy or thin. It's caused by a mix of factors, and the three main drivers are number one, muscle loss, known as sarcopenia. Sarcopenia is age related muscle loss. Muscle is your largest glucose absorbing organ. When we lose muscle through aging, inactivity, bed rest, or cancer treatments, we lose our biggest tool for controlling blood sugar. Physical inactivity causes muscle loss. This is why exercise is essential in managing your blood sugar levels. The second main driver of insulin resistance is chronic stress and cortisol. Cortisol, a stress hormone, raises blood sugar to give you instant survival energy. Cancer, long medical treatments, anxiety, and fatigue all increase stress levels, so cortisol often stays high. High cortisol leads to higher blood sugar and more insulin resistance. The third main driver of insulin resistance is sleep disruption. One bad night of sleep can increase insulin resistance the next day by up to 20 to 30%. Chronic sleep interruption keeps blood sugar elevated. Other key factors that cause insulin resistance include genetics, age, lifestyle, chronic systemic inflammation, physical inactivity, metabolic factors primarily driven by weight gain, especially belly fat, and certain medications like steroids or chemotherapy. Insulin resistance isn't caused by one single thing. It's a combination of biology, life circumstances, and the stressors your body has been navigating. When glucose stays too high for too long, it can damage multiple organs. It can damage your blood vessels, nerves, eyes, kidneys, your heart, and your feet. Think of blood sugar crystals as small shards of glass circulating in your bloodstream. Too much sugar in your blood is like having broken glass tearing at and damaging your delicate artery walls, making the lining rough. A healthy artery wall has a non-stick gel like lining. Think of it like Teflon. High glucose levels rapidly damage this inner lining, which make the vessel walls rougher and sticky. When the vessel lining becomes damaged, it triggers a chronic inflammatory response. Inflammation in your arteries is like having rusty pipes in your house. Rusty pipes are more likely to get clogged and eventually burst. The combination of inflammation and a rougher, sticky lining makes it easier for substances like fat, cholesterol, and calcium to stick to the artery walls, forming what's known as plaque. Over time, the plaque buildup narrows and stiffens the blood vessels, a condition called atherosclerosis, or hardening of the arteries. This condition impedes normal blood flow and can eventually form a blockage, causing a heart attack, stroke, or nerve damage, known as neuropathy. In addition, glucose also clings to long lived proteins like collagen and elastin. This process essentially glues proteins together to form what's called cross linked proteins. Proteins then become discolored, weak, and hardened. As a result, these crosslinks make tissues stiff and less flexible, leading to limited movement and aging issues like diabetes, hardened arteries, Alzheimer's, stiff joints, high blood pressure, weaker lungs, and wrinkly skin. So, what does high blood sugar actually feel like? Patients often tell me, I feel tired all the time. I'm thirsty. My thinking feels foggy. My energy drops after meals. My hands and feet are painful and tingly. I get hungry again quickly. These symptoms, along with frequent urination, slow healing, and blurry vision, happen because your cells aren't able to use glucose, even though there's plenty in your bloodstream. So your brain says, eat something, I'm not getting fuel. Meanwhile, your blood sugar is still rising, and this mismatch can feel very frustrating. But understanding the physiology gives you back a sense of control. The good news is that many of these symptoms improve once blood sugar improves and is better controlled, sometimes within days to weeks. Your body responds positively when it gets the support it needs. High blood sugar often creates low cellular energy because glucose isn't getting into the cells that need it, especially your muscles and brain. Movement becomes a powerful tool because your muscles become more sensitive to insulin when they're active. Your working muscles start pulling glucose out of your bloodstream even when insulin is low. So just moving more can help your energy begin to return. Some of you may have developed diabetes during certain treatments because they can raise blood sugar and increase insulin resistance. This type of diabetes is referred to as secondary diabetes because it's caused by something else. This form of diabetes is not caused by lifestyle. The treatments that can cause secondary diabetes include steroids, chemotherapy, immunotherapy, and other medications. Corticosteroids, commonly referred to simply as steroids, cause high blood sugar in three ways. Number one, they make the liver release more glucose. Number two, they increase insulin resistance. And three, they make the muscles absorb less blood sugar. Steroids are prescribed primarily for their potent anti-inflammatory effects on chronic inflammatory diseases like asthma, COPD, arthritis, eczema, tendinitis, severe allergies, multiple sclerosis flare-ups, and even carpal tunnel syndrome. Steroids also calm the immune system, so they're used to treat overactive autoimmune system diseases like ulcerative colitis and Crohn's disease, and they're crucial in organ transplantation. Immunotherapy is a type of treatment that uses the body's immune system, usually your own, to find and destroy cancerous cells. But it can significantly raise blood sugar and trigger new onset diabetes. Radiation, chemotherapy, surgery, steroids, and some immunotherapies increase inflammation. Inflammation makes insulin's signal weaker. It's harder for insulin to unlock the cell, and glucose builds up in your bloodstream. Your body has been working incredibly hard, and this is a common physiological response to powerful medications. But the same tools we'll talk about in part 2 can still make a big difference. Your numbers aren't a grade, they're information, a map. They help us understand what your body needs so we can support it effectively. The A1C test, also known as hemoglobin A1C, measures the percentage of the hemoglobin in your red blood cells that are coated with sugar. Glucose sticks to hemoglobin for the entire lifespan of red blood cells, which is about 3 months. That's why the A1C gives us a 3-month picture of your average blood sugar. Fasting glucose shows your baseline. Post-meal numbers tell us how your body handles meals. Here's how A1C converts to blood glucose. This conversion just makes it easier to see how your A1C correlates with your estimated average daily blood sugar levels. By knowing what your A1C actually means, it can help you connect how your lifestyle, diet, and medication choices affect your average blood sugar over time. For example, an A1C test result of 6.5% means that your average daily blood sugar level is around 140. And an A1C of 7.5% means that your average daily blood sugar level is around 169. The human body is very resilient and incredibly responsive to change. Small changes in your daily habits can make a big difference. Moving more will enable your working muscles to pull sugar out of your bloodstream. Light strength training will begin restoring insulin sensitive muscle tissue. Reducing stress will lower your cortisol levels and bring down your blood sugar. And sleeping better will improve your insulin sensitivity the next day. Thank you for being here today. If you're living with diabetes, whether long-term or newly diagnosed during cancer treatment, you're not alone, and there's so much you can do to feel better. Your body wants to heal. For the next session, we'll go into the practical steps, what you can do to avoid spikes and to stabilize your energy day by day. See you in the next video.